The macula is an oval pigmented area in the center of the retina where the ganglion cells are heavily pigmented, condensed, and multilayered. It is approximately 5.5 mm, that is 3-disc diameter. Its center is approximately 4.5 mm, 2-disc diameter laterally, that is temporal to optic disc, and approximately 1 mm, 0.5 disc diameter inferior to the center of the disc. In degrees, it is 17 degrees from the optic disc. Its yellow hue is because of the antioxidant xanthophyll carotenoid pigments including lutein and zeaxanthin. The concentration of both pigments is highest in the macula, but there is more cumulative zeaxanthin than lutein in the macular region, while more cumulative lutein than zeaxanthin in the peripheral retina. They are found in the photoreceptor inner segment. The newborn has little if any of these pigments, but they gradually accumulate from dietary sources. The pigment absorbs blue and ultraviolet rays (UVR) to protect the macula and reduce chromatic aberration. Xanthophyll pigments of the macula dissolve in histological specimens, so it does not appear on histology slides. The macula is subdivided into the umbo, foveola, fovea, parafova, and parafova based on number and rows of nuclear layers. The fovea is the central depression of the macula formed as retinal neurons are displaced, leaving only photoreceptors in the center. Measuring 1.5 mm, 1-disc diameter, it has no rods but the highest cones concentration. Has a cone to ganglion ratio of 1:1, where ganglion cells synapsing with foval photoreceptors are in the parafoval region. The fovea consists of the internal limiting membrane that is Muller always present, outer plexiform layer also known as Henle's layer, outer nuclear layer, external limiting membrane, photoreceptor layer that is cones, and RPE. The outer plexiform layer is oriented obliquely in the fovea, where these curved fibers called Henle's fiber layer, leading to a curved wall of fovea known as clivus, in contradistinction to its perpendicular orientation in the peripheral macula and retina. This explains the petaloid pattern of cystoid macular edema. The foveola is 0.35 mm centered at the umbo, with most xanthophyll pigments concentrated there, and it is free of blood vessels also known as foval avascular zone. Only cones and Muller cells appear there, no rods, bipolar, or ganglion cells. The parafova is a 0.5 mm area surrounding fovea. It contains the largest accumulation and the thickest outer plexiform layer in the macula. These layers are thickest to accommodate the input of cones in the fovea. The parafova is 1.5 mm area surrounding the parafova. Overall, the density of rods is greater than that of cones except in the macular region, where cones are concentrated, rods are absent from the fovea. So basically, anatomical macula is 5.5 mm, that is 3-disc diameters, with its center. The fovea is around 1.5 mm, 1-disc diameter in its diameter and has the highest concentration of cones, with no ganglion, inner nuclear, or inner plexiform layers. The outer plexiform is curved and is called Henle's layer.